Childhood obesity and its effect on chronic disease in adulthood. Childhood obesity is a global problem and remains to be a public health concern. During 2011 to 2012, approximately 17% of children and adolescents were affected by obesity. Childhood obesity is associated with metabolic and endocrine disorders leading to early development of hypertension, cardiovascular disease, type 2 diabetes, and non alcoholic fatty liver disease. Annually, obesity accounts for approximately 9% of all healthcare expenditures and more than likely will continue to increase as our obese youth enter adulthood. Many studies have shown that high levels of body mass index among children and adolescents are associated with adverse levels of lipids, insulin, and blood pressure. Longitudinal studies indicate that childhood BMI is associated with vascular fatty streaks and with raised lesions, obesity, left ventricular mass, and premature mortality in adulthood. Besides being genetically predisposed, socioeconomic factors also play a role in obesity. Specific behaviors are also predictors of obesity. There's evidence to show that the type of health care that most people receive relates to their economic status. Obesity prevalence varies by income and education level, although patterns might differ among adults and youths. Lower income children are more likely to be obese over their higher income counterparts, although that's not consistent across all racial and ethnic groups. During 2011 to 2014, the prevalence of obesity among U.S. youths aged 2 to 19 years was 17% and was lower in the higher income group than in the other groups, and also lower in the highest education group than in the other groups. During the last decade, policymakers have become increasingly interested in addressing childhood obesity prevention. Additionally, there are organizations like the Childhood Obesity Prevention Coalition in Washington, D.C., whose goal is to combat childhood obesity. The Obesity Prevention and Fitness Priority aim to advance activities to improve nutrition and increase physical activity to promote healthy lifestyles and reduce obesity-related conditions and costs. In conclusion, the idea of merely encouraging parents and children to eat right and exercise may seem logical. However, there are other factors that come into play.